Specialist, Vice President of Corporate Alliances here. And as I mentioned, I am so excited today to have Bruce Lindsay on, who is responsible for all the national broker partnerships at CenterWell. And for here, us at Senior Marketing Specialists, it's certainly probably not a new relationship, but we haven't done a ton of training and a ton of communication about these value-based care organizations. I know they're growing in such popularity, but we just haven't, we are really slow to choose who we're partnering with. We're really slow to choose who is it that we want to put in front of our agents. But working with CenterWell, seeing the direction the insurance industry and Medicare especially is going, CenterWell made so much sense for us. And Bruce, you and I have gotten to work together kind of in passing for years now, but I'm so excited we get to work together on this project. So Bruce, thank you so much for joining us today.
No, you bet. I think it's, the value-based care conversation, it's not a new model, right? It's been around for a good number of years, but I think as we talk to agents and agencies and you talk about value-based care, it's almost a foreign language because many agents or agency, they've heard the verbiage, right? They hear
Yeah.
about the model, but they're like, how do I do it? How do I get my hands around it? And more importantly, how does that help me as an agent or agency? And why should I care about it? And I think those are all good things for us to share with your team so they really know and get comfortable of talking value-based care.
I think, and you know what? You talk about that. This isn't a new concept, but there's been a lot of advances in value-based care. There's been a lot of changes and updates to where it is helping providers, it is helping consumers, and now there's a very clear path and where it's helping agents do what we do best, which is advising people how to finance their healthcare. So, Bruce, for those of us who may be not late to the game, because there's no such thing
Mhm.
as late, there's just where you're at in the opportunity. What is value-based care? How can an agent talk about value-based care?
Yeah, I think the biggest part of value-based care that we hear from a provider perspective is I want more time with my doctor, right?
Mhm.
And honestly, the patients are right. If you think about your average visit with a PCP, Olivia, what do you think? 10 minutes,
Oh,
12
I'm
minutes if you're
lucky. I
lucky?
spend way more time in the waiting room and lying about my weight than I do actually talking to the doctor.
That's you're absolutely right. I mean, I think about a year ago, I took a flight down to Florida and I had my ear, it didn't pop it just the pressure wouldn't release. And I
Mhm.
actually went to see a local ear specialist, and I don't think I was even in the office with a specialist for more than 10 or 12 minutes before I left the door.
Yeah.
And so one of the pieces that we are thrilled about with working with our patients is they get on their first patient appointment on the annual wellness visit between 40 minutes to a full hour. And if
Wow.
you think about that, I mean, that is unprecedented and unheard of to spend that type of time with your doctor. And so with CenterWell, I mean, we're not in all states across the country, but I will tell you, I've got family in healthcare here in Wisconsin. And when I talk about the model of CenterWell and we talk about the time, they're like, how can you possibly spend that much time with a patient?
That was
And
my
the whole
first
goal,
question. How does this
yeah,
happen?
I mean, the whole goal is we want to create positive health outcomes for our patients, right?
Mhm.
So our goal is to keep them out of the emergency room and the hospital.
Mhm.
And that's the whole vision and value of what we're doing behind the curtain right now.
That's incredible. So let's talk a little bit about that. You mentioned more time in front of a doctor will equal less ER visits, less severe conditions. Why is that?
Well, I think the patients at CenterWell that we love working with are patients when you're going through the application process that says, Mr. Agent, Mrs. Agent, I really would like to establish a relationship with my doctor, but I want consistent health care throughout the year, right? And I
Mhm.
think as we think about engaged patients and unengaged patients, what one of the challenges that we face at clinic is maybe Mr. Johnson comes in January of this year, but we may not even see him for 5 or 6 years after that because the patient isn't seeing the value of coming in on a regular basis.
Yeah.
And if we have the ongoing appointments, data will show us, and the proof is in the numbers, that those consumers are staying out of the hospital and the emergency room because they're owning their own health at home versus
Yeah.
going into the facilities.
That makes so it's like kind of like what Medicare Advantage plans, right? Medicare Advantage plans are invested in keeping people healthy because the real expensive stuff happens whenever they let their health slip. So it's kind of more like being proactive about their health care and making sure that they're able and feel comfortable and financially stable to be able to go in for what might perceive to be some of the small stuff, so it doesn't equal the big stuff, which yes is great financially, but that's got to be a relief for patients and people who are receiving that health care, right?
Yeah, I would agree with that. And I think the other piece of it too is, and what's a shocking number that we talk to agencies and agents like yourself, Olivia, is a third of the seniors today that you're enrolling into plans have four or more chronic conditions. So
For That's insane.
yeah. And so if you think about that, if the average PCP visit is between 18 to 22 minutes, I always ask the question is, if you're a senior and this is mom or this is grandma that you're caring for, how can you possibly address those four chronic conditions in 18 to 22 minutes
Yeah.
per appointment that you're seeing the doctor? And you know the answer is you can't.
Hmm. Okay. So talking about this, again, not a new concept of this value-based care. Carriers, I think Medicare Advantage plans particularly are really leaning into this, probably for the reason of when somebody's taken care of holistically, when they're less shy or less reservation with going to the doctor, they end up staying healthier, which is cheaper for the plan. So I understand the industry is leaning this way because of the value and because it does in a lot of ways lower healthcare costs as a nation. But let me ask you, you mentioned in the beginning that you're not in every state, you're not in every area. Where where agents in our demographics can CenterWell help?
So the question is the demographics of where they can
Yeah,
help.
where I try to just elegantly ask the question, where are you guys at?
Yeah, well, I think that's a really good question. So if you think about geography across the state, as I start from the west, if you think about Vegas and Phoenix, right,
Mhm.
would be as west as we go. And then if you look at the southern corridor between Texas, Louisiana, Mississippi, down to
Mhm.
Florida,
Mhm.
and then we'll go up the eastern shore all the way to Virginia, and we go as north as Indiana and Kentucky, and then finishing in Missouri and Wichita, Kansas.
Okay. Okay. So roughly how many locations is that, and are you guys looking to grow?
Yeah, that's a really good question. So currently, we are servicing 15 states across the country.
Okay.
And one of the exciting pieces over the last couple of years, first, I'm going to start with the Walmart merger and acquisition that happened
Yeah.
with CenterWell just last year. What I don't want your teams to be confused about is this isn't the retail program that they would work tabletops within the Walmart stores. This
Mhm.
is the clinical side of the business. So what happened was Walmart Health, they were going through some changes, and conversation came to CenterWell and say, hey, would CenterWell be interested of acquiring some of our locations? And so what we wanted to do is test market it in 23 locations across the country. And so that stemmed from Florida to Georgia to Texas and then Missouri. So in your backyard, Olivia, in Gladstone, we have
Mhm.
a CenterWell senior primary care clinic
Mhm.
attached right to the Walmart Supercenter. And so our whole idea was is, hey, one, we can increase foot traffic within the Walmart store. We can increase foot traffic into primary care. And while they're there, they can get their hair done, they can get their groceries, and if they
Yeah.
need to stop by the pharmacy, they can get that as well.
Yeah. So convenience is kind of a significant part of like a lot of the locations that you guys are at are going to be more convenience based. Now, a lot of other organizations, like, similar to Centerwell, tend to talk a lot about one of the most underserved demographics, and that's going to be our or low income clients, Medicaid eligible, non-Medicaid eligible, whatever the case, but just a lot of them will focus on those low income people. Can you talk a little bit about why the organization is not exclusively offered to those low income, but why maybe they might benefit the most from what CenterWell does?
No, that's a really good question because one of the pieces that we did research on over the last 12 months or so is how are we serving the folks who are low income? And
Mhm.
we've actually have seen a 21% increase on primary care visits for those who are low income beneficiaries on the Medicare program. So we're able to get them into the doctor's office and allow them to get care under the value-based care model. And
Yeah.
so that's been a huge win for CenterWell.
That's awesome. That's incredible. So, we've talked a lot about the value that it has for for consumers, the value for our seniors. I think the value for the providers as well. I think, correct me if I'm wrong. I'm going to say this as a statement, but I want you to agree with me or maybe disagree with me that providers really enjoy working with the value-based care because they feel like they actually get rewarded for doing what they got into medicine to do, which is truly taking care of people versus on more of a traditional care delivery system, they're kind of forced into these 7-minute appointments and more forced into paperwork. Is that how I understand that correctly?
Yeah, so let's talk about that for a minute. So if you
Sure.
think about the value-based care model, our physician panels are between about 500 and 750 patients for that doctor that they would have within a panel. And so those of you listening today, well, what does a panel mean? A panel
Mhm.
is a bucket of how many patients that we can see within that size for one doctor, right?
Mhm.
So if you look at fee for service in a traditional clinical model, the average panel size for a physician is 2,500 patients
Oh
that
my
they
god.
would have in their bucket. So you're right. Our doctors appreciate the ability to sit down and have a conversation with the patient in the office and
Mhm.
really understand their journey and their healthcare. What I also like as well is that, so let's say Mrs. Johnson, let's say she's in her early 80s,
Yeah.
but Mrs. Johnson's uh, son or daughter, they live in Dallas, Texas. So
Mhm.
within the patient room, we can automatically Zoom call the family over the TV screen while then the doctor is meeting with the patient in the office so they can be part of the conversation.
That's wild. So it really is listening to medically, yes, but listening to that patient and figuring out what do we need to do where they feel comfortable and they're getting a level of care that actually works for them.
Correct. No, and you think about it too with value-based care is we're not about volume of patients that are coming into the door. Our biggest goal is to drive positive health outcomes within the clinical side of the business so we can help with the prevention and proactive care management for the patient and then also for the doctor to be part of that conversation as well.
Okay. So we've talked about the consumer, like why does this make sense for a consumer? And can you talk to this a little bit because I do think there is I keep kind of jumping around. As far as the consumer thinking, a lot of people do say, focus on the low income clients. And I think a lot of that reason was because of for the agent side, for the enrollment side, oftentimes people who are dually eligible back in the day, it's different now, but a lot of these individuals have more of an opportunity to change Medicare Advantage plans in the middle of the year. And that's why a lot of these people tended to target these low income. But I know when you were in our office a few months ago, you said that that low income isn't your only client base and you fact do have people that are who are not considered a low income. So can you talk a little bit about that, about like who is a prime patient, who's someone who benefits from this?
Yeah, I think the biggest piece, if you think about the clients that you're enrolling into Medicare Advantage, Medicare Supplement, and then certainly Original Medicare, right? That would be the bread and butter for CenterWell. It's a senior focused primary care organization.
Hmm.
And when I'm in front of agents every day and I talk about who is the right patient for CenterWell,
Hmm.
always put in the back of your head is looking for clients who are looking to manage their health care, right? And so I think the biggest risk, and we talked about this a little bit before, is that unengaged patient. And it's hard to help a patient walking through the doors of CenterWell if they're not coming in on a regular basis. And so as we're thinking, and Olivia, can you believe we're going to be talking OEP prep in probably a month or so,
That's
as everybody
wild.
starts thinking about AEP and all of that. But
Yeah.
when I was an agent, and this is my gosh, 16th year in the business, starting as an agent, the primary care conversation now is more important than ever to be added into your plan checks as you're working with your clients in the office.
Yeah.
You know, Mrs. Johnson, who is your primary care? When's the last time that you've been into a primary care office, right?
Mhm.
And agents will ask, like, why is that important? Why should I be asking those questions? So you think about it, every plan that you're writing has a star rating, right? And we all know the importance of a plan achieving a 5-star rating.
Yeah.
Then there's HEDIS measures that get in that are part of that equation as well, right? So all the things as an agent that you're impacting HEDIS, you're impacting the 5-star rating that you're working to achieve for that carrier. At the end of the day, it's benefiting everybody.
Yeah. Yeah. That's again, I love the idea of what this does. I love how it benefits our most at-risk demographic and our least healthiest, for chronic conditions. That's wild to think about that the statistics have gotten there, but I mean, I surely believe it. Let's talk a little bit about the agent opportunity, if you don't mind to switch gears a little bit. So,
Sure.
what is it that CenterWell, what's the appeal to partner with agents, and how does that help CenterWell continue to see more client or see more patients?
Yeah, for sure. So one thing I want to talk about, Olivia, as long as we're on this topic, is we
Yeah.
talked about mergers and acquisitions this year. Two other important mergers that happened over the last, I would say, 2 to 3 months would be the Villages and then Max Health in the state of Florida. So if you're in Florida, certainly some opportunity with those two groups that have acquired through CenterWell. What I'll tell you today, at the time of this recording, is CenterWell owns those entities and we're part of that, but we're keeping that side of the growth team right now of
Hmm.
building opportunity. But if you're in the Florida market, Tampa, south of Tampa, and Orlando, those would be conversations that we'd want you to engage with our Florida team so they can keep you abreast of all of the changes that are happening with those two recent acquisitions. I wanted to make
Okay.
sure that we added that to the conversation.
Okay.
But to talk about what we do for agents, and I think the biggest piece is one, if you have not been in to tour a CenterWell clinic as an agent yet, I would encourage you to do so because I really believe this is where the full circle comes together so you can see the model of the doctors, you can see the front end staff, you can see our activity centers, and really see the opportunity that CenterWell has to provide to you. That would be the first step that I would encourage you to do. The
Hmm.
second piece is within the teams, we have community engagement professionals. We call those CEPs. And our community engagement team, they're actively working the community with grassroots marketing, working with senior centers, working with low income housing, working with laundromats. If you can think a senior going to a facility, our teams are actively engaged with those groups. So if you haven't met your local community engagement team, that would be another opportunity as an agent that I would encourage you to do.
Okay.
Also talked about the activity centers, and I think that's an important piece of what we do from an agent perspective. So, Olivia, as you think about ANOC meetings that'll be happening during AEP or member education events that you're looking at doing, we can host those meetings in the clinic, and they don't cost you as an agent or agency anything to be able to use. We just have to schedule those.
That's incredible. So we do have a question here from one of our agents that's basically saying, "What do I do first to get started? How do I get connected and learn more about my CenterWell engagement?"
Really good question. So Olivia has a master list of our associate directors in each of the markets. And what we can do is we can get you connected to our teams where the clinics are located, and we'll get you in for a tour and have you meet our community engagement professionals and get you started with the opportunity within the clinic.
Okay, perfect. And again, we do have that list. So agents who are attending today, make sure you reach out to your growth specialist. That's going to be either Will Pierce, Ben Laves, or Clayton Clemens, and they can absolutely get you connected, let you know exactly who you need to speak to in order to take advantage of the opportunity of working with CenterWell. I have another question here, Bruce, if you're okay with that. Somebody was
For sure.
asking about plans that we work with. Now, you and I were able to kind of talk about carriers and things like that, but I think you guys probably, I think, even work with more carriers than other ones do.
Yeah, that's a good question. So the best way to answer that would be, so all of the national payers across the board, we have national contracts with, right?
Mhm.
And what we'd want to do, so there are some regional based carriers that we work with, and there's some that we don't. And so to answer that question is I would get you to our local market, and they have a booklet that they can provide to you and information on the carriers we do accept. So then you feel prepared going into that client meeting. So you know which groups we work with and which groups we don't. One piece I would call out at the time of this recording is Devoted Health. Devoted is contracted with us across the entire country in the states that we work with, other than the state of Florida.
Okay. Okay. That makes a ton of sense.
Hmm.
So, talking like this again, we talking with agents who have maybe worked with other value-based care organizations and things like that. When you're working with these people who are so with these organizations that are so key on getting agents involved and helping them drum up this community involvement, we kind of see that's a double-edged sword, right? One side is that I have this person working on my behalf and working with me as a partnership. But then there's the other side of like, well, if I start writing business, I'm going to try to keep my clients away from this because I am worried about protecting agent of record, or I'm really anxious about like, I don't trust that my clients will be protected from another agent coming in. That's
Hmm.
something that you guys do a little bit differently. Do you mind talking a little bit about how you guys protect those agents of records?
Yeah, that's a real good question. So when CenterWell first started working with agents and agencies, back in the day, we actually had a program called Agent of the Day. And we would allow agents to staff the clinics, be active within really the capacity of the clinic, and work with patients as they were coming in the door. And looking back at it, in the beginning, it was a good starting point for us, but we quickly pivoted and realized that it was creating a bad rap in the industry with the brokers, having an agent sitting there at the front of a clinic or within the clinic. And so what we made a decision to do is we still allow agents to come in to use the activity center and our offices. They can just no longer sit up front in the lobby and interact with patients. So for example, let's say Bob Smith is an agent in um, Texas, right?
Mm-hmm.
They want to utilize our office because they work from home, but they don't have office space to be able to meet a client. All
Mm-hmm.
that agent would need to do is contact our local team and say, hey, Renee, do you have any space available on Tuesday from 12 until 4 that I could use the agent office? And as long as that office isn't taken, we can work with the agent, allow them to meet their clients that they're inviting into the clinic to be able to help them with their plans that they're writing that day.
That's incredible. And again, so it sounds like you guys are really leaning on your community engagement specialist and agents, your growth teams to really spread the word around Centerwell and that you guys are really relying on those relationships to help for your growth.
Yeah, because if you think about it, it's a win-win for both companies, right? It's a
Hmm.
win for the agent because they'd have a professional space that they could write plans for and business with a client. We win because this may be the very first time that Mrs. Johnson is walking into a Centerwell clinic, and she may look at the facility and say, "Whoa, what am I missing? Is there
Hmm.
something here that I should be taking advantage of?" And she may even ask a question, could I tour the clinic while I'm here so I can
Hmm.
learn more about it? So it's a win for us and a win for you.
Yeah, that makes, and again, that's those best deals when we're working with agents about how to find strategic alliances or networking partners. It's all about, it's got to be a win-win situation, and you got to make sure you're partnering with individuals who are also growth minded and who understand that this has to be a win-win situation. It sounds like, again, what you all have built, and what you, I think the growth in CenterWell as well, just the amount that I've heard about CenterWell over the last 5 years, even in this market, where, again, for those listening, I cannot say enough, when we're looking at emerging trends, when we're looking at where is the industry going, and all this area where there's disruption and money grabbing, and talking about what carriers are going to do over the next 5, 10 years. There's so much stock at every level, the CMS level, the carrier level, the agent level, the consumer level, so much attention going to these value-based care organizations. And if I've heard, when you're talking to these carriers about what their plans are, and their plans for growth, or their plans for retention in upcoming years, you all tend to be at a center for a lot of their operations, and how they're, more so than others, about how they're going to continue to finance healthcare in
Hmm.
2026, 2027, and beyond. So really impressed what you guys are growing, really impressed what you guys are doing, and how you're helping agents. I know we're at that 30-minute mark, but I just, Bruce, I know you have so much to offer. This has been, I love just these conversations, just these couple friends over a glass of wine. I guess it is only 2:30 here in mid Missouri, but don't judge me. Couple friends just talking about, our corners of the world, our corners of the industry. Bruce, is there anything else that you want to make sure that our listeners and people, when they go and talk about this to their office staff, to their agent friends, to somebody, anything else you want to make sure you get across in this time?
I think the final piece that I would add to is you think about companies like Amazon and Google and GE and Walmart, that mix. It's like these large companies strive every day for a large net promoter score. And
Yeah.
really what that means is, how often and likely are you to promote to your family and friends of where you do business? And most of those companies I talked about would be ecstatic to be somewhere between 70 and 75 with their
Mhm.
NPS score. And we ran the numbers just this past year, and we were trending at 85.5 for an
And in
NPS score.
healthcare, that is unheard of.
It
Like
is.
healthcare, you're happy to be in the 30s or the 20s.
Yeah, I mean, because ours, the population we deal with is they're more than happy to share their good experiences and their bad experiences. And so that
Mhm.
tells us they're going to church, they're going to community events, they're going to their family. They're talking about the experience that they have with CenterWell. So we're super proud about that, and wanted to make sure that everybody knew about that success with CenterWell over this
Yes.
last year.
Yeah, it's kind of like, it's interesting how using a net promoter score has kind of put a scientific formula into a quality metric, right? Something that you think is and you've hard to put a metric to. The NPS scores have certainly done a great job of really quantifying the quality care that somebody gets. So congratulations on that score. Again, in the healthcare space, people would be thrilled. Any hospital, doctors, providers, any network would be thrilled to be in the 30s of a net producer, or excuse me, net score. Am I trying to say net promoter score? Excuse me.
Yeah,
But
no
Bruce,
worries.
thank you, thank you, thank you, thank you. Again, for anybody who has any more questions, comments, concerns, threats, or promise, please call our office, 1-800-689-2800. Talk to one of our growth specialists. Again, either, Ben, Clayton, or Will, or one of the individuals on their team, about if there is an opportunity to connect you with a CenterWell engagement specialist, and how we could help you both enrich your current clients' healthcare, their lives, and also how to help you keep your marketing funnel full, and how can you build your book of business with something like this that is going to continue to drive growth in the industry. So Bruce, I really appreciate the time.
Fantastic. Thanks, Olivia.
Of course, again, our number here, 1-800-689-2800, or email us at contact@smsteam.net. So until next time, guys, have a great rest of your day, and we'll see you later.